Hello, my name is Rhonda. I am Mary's nurse today. I'm going to teach her how to give her insulin through the insulin pen. I'm just going to speak to Mary now. Hi Mary, I'm Rhonda. I see that the doctor has changed your insulin from the vial that you're used to using to the insulin pen. I went online and printed off some information about it with some pictures so that we can walk through this so that you're comfortable when you get this pen from the pharmacy. There's some great advantages about using the insulin pen as compared to the vial. It's easy to carry. Comes in like a pen, like a writing pen. You don't have to draw insulin from vials anymore. It's already ready to go. Almost every insulin type is available in the pen, including yours, which is the 75-25 mixtures. It's easy to dial up the dose that you need. Less waste with insulin when using a pen. So there's a lot of advantages to it. As you have been doing in the past, you've given yourself insulin, so you know to wash your hands, gather your equipment, get your pen ready. You always want to check the expiration date when you get your new pen. So when you open the bottle, look at the expiration on the pen. It actually does look like a pen. This is not a pen, or an insulin pen, but this is just a marker, so I can show you just kind of how easy it is. But I also have a picture here for you. So what we're going to do is just walk through the equipment. So this is the pen. You take the lid off, and you'll see the insulin vial in there. This comes already ready to go for you. All you have to do is apply your needle and get ready to give yourself your insulin. So as you see the insulin here, you do have a mixture, so it will be cloudy, so it will be important to mix the insulin. So what you'll do is you'll take it between your hands and you'll do this like you've done before with your other insulin, because you had a mixture before. And you'll also take the vial and you'll go up and down 10 times to make sure you get your insulin nice and mixed. So once you've done that, you're ready to give yourself your insulin. So with your lid off, you're going to take the stopper top and you're going to clean it with alcohol. You're going to apply your needle and it just screws on. There's a little, I'll show you right here, there's a little needle cap that covers the needle so you don't poke yourself. And you'll just take that off and throw it away. The original cap, the outer cap, this bigger one here, you'll keep that so that you can dispose of your needle properly when we're done. So you put your needle on, and every time you put a new needle on, you have to prime your insulin into that needle. So prime every single time that you put a needle on. You're going to be doing this every morning, 35 units. So you put your needle on, you'll turn the little vial, the dial at the bottom, to 2. It's really easy to read, and for your age, you're 75, this may be great for you because you'll be able to see the numbers. They're nice and big. So you'll dial to 2, and as you dial, you'll notice a little plunger at the bottom kind of comes out a little bit. And that's so that when you give yourself the injection, you can feel yourself pushing the needle in just like an insulin syringe. So what you do is dial to 2, and you're just going to give it a little air shot. You're going to push that bottom in, and it's going to shoot the insulin into the air. You should see a nice stream. If you see it bubble, then that's not a good thing. Try it again, take the needle off, get a new needle, and repeat those steps to prime every time. So we got a nice stream of insulin into the air. So now we're ready to dial our dose. So what we're going to do is we're going to dial it to 35, and then you're going to give your insulin like you always have. You're going to clean the spot, we'll say your thigh. You're going to inject, and when you inject, you're going to push that stopper down. You're going to hold it down for 5 seconds, and then release. And when you release, you're done giving yourself your insulin. You remove the needle, you put that plastic outer cap, and you dispose of it properly. And as I said, Mary, I will give you this information to take home with you. It talks about rotating sites, and pretty much any questions you have will be in this. It'll also come with your insulin pen when you pick it up from the pharmacy. And if you have any questions, don't hesitate to give me a call. Ask the pharmacist, call the doc. And you can also, if you're familiar with the website or the computer, you can also go to their website. They have a great video that will actually take you step by step, working through and walking through every step of how to use that pen. Okay, Mary? Thanks, Mary.